Princess of Wales thanking the public for their support after announcing her cancer diagnosis. Catherine posted a video message on Friday to share that she's been diagnosed with cancer and is in the early stages of treatment. In the video, she said it's taken time to explain everything to their kids in a way that's appropriate for them and to reassure them that she's going to be okay. Now, this poses the question, though, right? How do you talk to your kids about something like this?
Joining us now, Dr. Erica Lee, a psychologist at Boston Children's Hospital. Always great to see you, doctor. Thank you.
Of course. So good to see you.
Good to see you, doctor. You know, William and Catherine's 3 children, they're ages 10, 8, and 5. In your opinion, are they old enough to understand their mom has cancer?
Yeah, I'm so glad you're talking about this topic because it's a really difficult one for a lot of families. What we know is that children's understanding of illness changes as they develop, right? So how we talk to them about what's going on is going to match their age. So at age 5, kids understand what it means to be sick. So they may worry, you know, am I going to catch cancer? Are other people going to catch cancer? Helps to explain to them that this may take longer to recover from than something like the cold or the flu, but your medical team is taking good care of you. But then at age 8 and 10, kids can usually understand the basics of something like a cancer diagnosis. So they may start to fear, what does it mean if I lose my parent? What's going to happen to my family? So you're going to want to explain to them how is treatment going to impact you as you're going through it and what's going to change at home. And really, no matter the age, you just want to keep things as simple and direct as possible.
So, doctor, for parents battling a serious illness or disease, what's the most important thing that their kids need to hear?
Great question. So kids need to hear fundamentally, I'm safe, I'm going to be taken care of, and that I can come to you with my really difficult questions and my difficult feelings. Because kids at first, they may not know how to feel or what to think as they're processing this news. And they may also feel like they need to protect you, the parent, from how they're feeling. So keeping that conversation going gives them permission to have those complex reactions and the ability to process it together as a family in real time.
I got to ask you this. What if the kids ask, you know, are you going to be okay? And you really don't know the answer.
Oh, also a great question, because this is the scariest thing for a parent who's sick. It is okay to tell them that you don't know, right? And that you're also feeling sad and worried, because as hard as it can be to tell kids the truth, and again, in a developmentally appropriate and simple way, kids can tell when something is wrong, right? They're really looking to their parents at all times for cues. And if they don't know what's happening or they think there are secrets, they're likely going to fill in the blanks with their own assumptions. So getting the chance to hear the hard news directly from their parents and then the time to ask questions and think about it together can actually go a long way towards reducing some of that anxiety and making them feel more secure. And then parents get the chance to model, okay, how are we going to cope with this really difficult news as we're figuring it out, as we're figuring out the I don't knows, and how are we going to deal with this scary uncertainty?
No, it is, but it's a discussion that needs to happen. It's how you do it. And then on top of trying to heal yourself, it's complicated for sure. Dr. Erica Lee, Boston Children's Hospital, thank you so much, doctor. Stay well. We appreciate you.
You too.
Thank you.